Hi, I'm Betty Voss, and I'm from Kansas, and I've been a nurse probably over 44 years. And I graduated from what we call the Diploma School in Salina, Kansas in 1955. I'll tell you what was similar, and they don't do anymore, is back rubs. At 6 o'clock, after dinner trays were picked up, then every patient got a back rub, and that was probably the most touched on feeling that nurses did then, other than bed baths and routine things.
Hi, I'm Megan Voss. I have a DNP in Integrative Health and Healing. I'm also a registered nurse, and I'm from the United States. I currently work at the University of Minnesota Children's Hospital and also as faculty at the Center for Spirituality and Healing. In my current role, I work at the Children's Hospital at the University of Minnesota. I work as a nurse clinician, and I do integrative health consults on children who are undergoing blood and marrow transplant. So what does that mean? It means I give them tools, help them build resiliency and coping skills to get through the physical, mental, emotional, and spiritual challenges of transplant. My role at the Children's Hospital began when the lead physician, Dr. John Wagner, became inspired and decided he wanted to have integrative therapies as part of the BMT program. Knowing he wanted these therapies, but not knowing exactly what they were or how to build a program, he enlisted the help of Dr. Mary Jo Kreitzer, who I was lucky to call my mentor at the time and still today. And Dr. Kreitzer was insightful and strategic as always, and guided myself and two other DMP students to really do a deep dive. We spent about 3 or 4 months doing a needs assessment of the patient population, benchmarking with other programs across the nation, and really looking at the evidence of what would be safe and effective for these children undergoing such intense allopathic treatment. So after our 3-month period, we developed recommendations for a program and submitted that to the steering committee at the Children's Hospital. And within less than a year, Drs. Kreitzer and Wagner had gone out and sought funding and developed a role and posted a position to hire a program manager at the Children's Hospital. One lesson that my grandma has taught me is in watching her and her nursing colleagues. When she worked in Dallas, she had a group of friends. They were all nurses, and they called themselves the Queens. And they were fabulous, and they still are fabulous. And some of them are retired, and some of them are still working. And they live in at least 3 different, maybe 4 different states now. Mm-hmm. And to this day, they still get together. I've had that at different phases in my career, and I have that now with my integrative health and healing DMP friends. And so hanging on to those people who really get it, that was one lesson my grandma taught me.